Hello my friends, how are you? I hope you are all well. My channel name is Sohail Teaching. So now my topic today about what is brain injury. Traumatic brain injury. Today I will complete guide about brain injury. A traumatic brain injury (TBI), also known as an external injury, is an injury to the brain caused by an external force. TBI can be classified based on severity, ranging from mild traumatic brain injury to severe traumatic brain injury. TBI can also be characterized based on mechanism or other broader category that may involve damage to other structures such as the scalp and skull. TBI can result in physical, cognitive, social, emotional, and behavioral symptoms, and outcomes can range from complete recovery to permanent disability or death. Causes include falls, vehicle collisions, and violence. Brain trauma occurs as a consequence of a sudden acceleration or deceleration within the cranium by a complex or combination of both movement and sudden impact in addition to the damage caused at the moment of injury. A variety of events following the injury may result in further injury. These processes may include alterates techniques, alterations in cerebral blood flow and pressure within the skull. Some of the imaging techniques used for diagnosis of moderate to severe TBI include computed tomography (CT) and magnetic resonance imaging (MRIs). Prevention measures include use of seat belts and helmets, not drinking and driving, not drinking and driving, fall prevention efforts in older adults, and safety measures for children. Depending on the injury, treatment required may not minimal or may include interventions such as medications, emergency surgery, or surgery years later. Physical therapy, speech therapy, restoration therapy, occupation therapy, and vision therapy may be employed for rehabilitation, consultation, supported employment, and community support services may also be used. TBI is a major cause of death and disability worldwide, especially in children and young adults. Males sustain traumatic brain injuries around twice as often as the females. The 20th century saw developments in diagnosis and treatment that decreased death rates and improved outcomes. Classification: traumatic brain injury defined as damage to the brain resulting from external mechanical force such as rapid acceleration or deceleration, impact, blast, waves, or presentation by a projectile. Brain function is temporarily or permanently impaired, and structural damage may or may not be detectable with current technology. TBI is one of two subsets of acquired brain injury, which does not involve external mechanical force. External mechanical force, all traumatic brain injuries are head injuries, but the later term may also refer to injury to other parts of the head. However, the terms head injury and brain injury are often used to interchangeable. Similar brain injuries falls under the classification of central nervous system injuries and neurotrauma. In neurophysiology research literature in general, the term traumatic brain injury is used to refer to non-penetrating traumatic brain injury. TBI is used classified based on severity, anatomical features of injury, and the mechanism. Related classification divides TBI into cleft and penetrating head injury. A cleft injury occurs when the brain is not exposed. Penetrating head injury occurs when an object precises the skull and breaches the durameter and the outmost membrane surrounding the brain. So friends, how is my topic about brain injury? If you like this topic, so subscribe my channel, press the bell icon so we know go to another video. Allah Hafiz.